give you an explanation of that today. The standard disclaimer for us ASX listed companies. But let me just give you a little bit of background on the market first. And for those of you who don't know, we've turned into a parcel world where we get so many parcels delivered to us personally and through our businesses and through corporations that it's just the growth of the parcel industry globally is just pretty much gone through the roof. And I'll share some statistics with you. Firstly, this is across 13 countries in the world because we do operate globally. It's a $159 billion market for shipped parcels around the world, up from 131 from the previous year. But if you actually go back 5 years, it is almost 5 times what it was 5 years ago to what it is today. So the parcel industry has absolutely skyrocketed, and I think we all understand why. COVID drove a lot of that when we're all sitting at home. Year-on-year growth is around 21%, and that's predicted to absolutely continue going forward. 491 billion in revenue. And that's, as I say, this survey is across 13 of the main countries in Western countries in the world today. So that works out to about 5,000 parcels a second, somewhere in the world, somewhere across those 13 countries. That's 436 million parcels a day. That's 41 parcels each per year. That's each and every person across those 13 geographies. Well, then I'm getting your ones. And that's about 137 parcels per household. And my wife is in the audience would say most of those are mine and not hers. But it's about right, to tell you the truth. But it just goes to show how many parcels that are zipping around the world and we literally take for granted. Now, everyone's talking about the gloom and doom of inflation and the worsening global recession that people are talking about. What's really driving this market now is how can they make more money and reduce their costs of this huge demand that's happening around the world. It is really an industry that is in overdrive of innovation. Compound upon that, the whole green issue around how can this industry reduce its emissions at the same time whilst packaged deliveries are just continuing to exponentially grow. The reality is that this industry is now the next industry that's been completely disrupted by technology. It stayed very basic for the last 30 or 40 years, but now it is truly in disruption mode, and it's being forced by software innovation. And so software is absolutely eating this industry. And what I'm witnessing is, even with the way the economics sit around the world today, we're seeing new startups appear every day. We're seeing VCs still continuing to fund companies to create better innovation in this space to the tunes of billions of dollars. We're seeing the large players having to restate themselves and reinvent themselves to stay relevant in this space as technology disrupts their marketplace. We could pontificate what the future of the last mile delivery is, or the middle mile delivery, meaning how do they get goods to you? And there's some crazy ideas like they'll manufacture it en route, although I'm not sure the train system here in Australia could cope with that. But and we've all seen drones flying around to your house and dropping parcels. Who knows what's going to come from innovation in the last mile? But the part that we absolutely operate in is in the exchange point. where people are exchanging parcels. And let me just briefly talk about this. You'll recognise it as locker banks, smart locker banks, but the reality is we call it chain of custody. And what we're interested in and what people are prepared to pay for our services is when someone actually cares about what's going in and what's coming out. So the more critical that information, the more critical that is, and it doesn't necessarily depend on the value of the goods. So if we use, for example, we sell to many US police forces, obviously in the US. If it's in their armory department where all their guns and ammunition are, they really want to know who's bringing stuff in, who's depositing stuff in, and who's taking goods out. That's a really important, irrespective of what the value of those goods are. Whereas in other areas, the value that people put on the importance of knowing who is in control of chain of custody is less. So the higher the chain of custody for us, the more value that we can provide to our customers. And exchange of goods doesn't necessarily mean it's click and collect from a consumer perspective. It's also for private companies. So our biggest customers today are Apple and Microsoft and some of the largest global tech companies. And they're very, what's important to them is being able to control chain of custody of their prototyping for Apple's products, for example, internally. So we see a lot of use cases for people wanting to control where and how goods are moved inside their organisations and outside of their organisations. And really what does this is the software. The physical lockers themselves are bits of tin or bits of metal of whatever description, and they are in reality a commodity. That's not where the value proposition lies for our business. The value proposition lies in the software stack that we have developed and continue to develop going forward. So the smarts sit inside the software, and we're building a complete ecosystem around our software stack. That includes being able to look at it in any location in the world. So a company like Apple can look across their globe to see where items particularly are. We deal with commercial customers, corporate customers. It can go inside residential, it can go inside shops, and it can be part of the logistics food chain of couriers being able to deliver goods into those exchange points and people take out goods inside those exchange points. Once again, for private and for public. And for public, it's like you see here in Australia, the Australia Post lockers. That is a very public, local consumer click and collect. We tend to focus more on the corporate end of the market, where it's specific goods for asset tracking and asset management of customers' deliveries that are getting distributed across their organisations. The important thing to know is that around 60% of our revenue today is international and predominantly in the US. So if you look at some of those names, they are some of the biggest names that we all recognise, obviously, as brands: Microsoft, Apple, Google, Netflix, Nike, just to name some. And the important part to know about that is that our technology is world-leading, world-class technology, because you cannot get inside these customers' organisations if your software is not up to scratch. And so therefore, it's a testament to the technology that we have, that we've been able to successfully gain the trust of these organisations around the world. And there's others in there, like we recently won a project with NATO, for example. We have many defence contracts as well inside our customer base. So that's really the important part to note, that the technology itself is really where our value proposition lies. So we have around 60% of the revenue coming international. And we're in the transformation phase of taking our company from the hardware component to purely a software component, where we will and are progressing to migrate our software into anyone's hardware. It won't bother us as to whose hardware you choose. You'll be using our software. And obviously, one of the core focuses for me has been to change our business model from perpetual style licensing, software licensing, which the company did in the past, into our own cloud environment, which we launched over 6 months ago, called TZ Cloud, and move all of those customers into our cloud environment and into a SaaS model. And we've successfully been able to migrate those some of those customers as part of that journey into a SaaS environment. We are only a fraction of the way into that migration. We've told our customers already that by September of 2023, that our perpetual licenses will go end of life, and that means that customers will either have to stand still and stay where they are, or they'll have to move to TZ Cloud and into our SaaS model. So right now we have less than 10% of our customers on our SaaS model, and we'll be doing that migration between now and the end of September next year. Right now we've had 100% success rate on migrating customers into our cloud, but typically those first customers are wanting to do that. I'm not suggesting for a moment we'll get to 100% of all of our customer base, but I suspect we'll get to a very high proportion of customers moving to our cloud. Our average cost of our SaaS model, if you think about those lockers and you consider those as doors on those lockers, we average between $8 to $25 a month per door. And so we have around 250,000 doors out in the field already. That's excluding all the new customers we continue to win. So that's the opportunity that we have in front of us from a migration perspective. Where we continue to add innovation. We're coming out with a whole new platform around the April timeframe of next year for what we call headless kiosks, headless locker banks, where you won't actually have a kiosk at the locker bank. You'll just drive absolutely everything from your mobile phone, and you will not need to have a kiosk in there. And that simplifies how our customers use our systems, and it's certainly what our big customers are demanding from us. The other benefit of having these large customers is they drive our behaviour on demand for features and assets. So, you know, a company like Apple drive us really hard. They're a great company, but they also lead us into what the next version of our software looks like. Less than a year ago, our recurring revenue, our MRR, was sub $100,000. As of 2 days ago, it was $313,000. I've already stated to everyone in the market, that we expect that to grow by at least 50% year on year. So that's really where we're driving. The whole focus of the business is to drive this recurring revenue, and you'll see hopefully this number continue to grow and expand as we do the conversion of our customer base from perpetual licenses to recurring revenue. That's it from me.
Thank you very much, Mario. OncoSil Medical has developed a regulatory-approved radiation therapy that delivers a radioactive particle directly into a solid tumor, killing the tumor without impacting the surrounding healthy tissue. Brian Leedman is a biotechnology entrepreneur who co-founded OncoSil and also another company you may be familiar with, as it presented here previously. Resap Health has just been acquired by Pfizer for $180 million. Please welcome the now very wealthy Brian Leedman.
Thank you, Jerry. And it's actually really lovely to be back in front of this audience. I remember presenting at the very first TechKnow Invest conference in 2015 when we just floated Resap Health, and it was the best performing stock on the entire stock exchange for that year. So going into 2016. So we've had some success in biotechnology. I've floated a number of companies. I've actually presented for many different companies over the years here at TechKnow Invest, and it's just lovely being back here in front of this wonderful audience. Now, this is my standard disclaimer. Now, in terms of OncoSil, we have a terrific board. Now, you may be familiar with a company called TZ Medical, which was actually founded in Perth, where I'm from. TZ Medical was a radiotherapy treatment for liver cancer. And the CEO of that company, a guy called Nigel Lang, is now the CEO of OncoSil Medical. TZ Medical was gained great famousness in the sense that it was acquired by a large pharmaceutical company about 7 or 8 years ago for $1.5 billion. And this technology that we have is similar to TZ, but better. And I'll explain to you why that is. Otto Batula is the chairman of the company. Otto and I have known each other for many years. He was actually a founding shareholder in OncoSil when I co-founded the company about 8 years ago. I've never actually been on the board of OncoSil. I was part of the VEN that actually established the company, but Otto's had terrific experience. He invests very heavily in the companies that he represents, and he's also on the board of other successful companies. And in terms of myself, obviously you're familiar with Resap Health, but I've actually floated 5 companies on the ASX now, and they've all done relatively well. Resap being the most recent success. It's the first time Pfizer has ever acquired an Australian-based or developed healthcare company, and it was a significant win for shareholders. Share price, I think, was up 450% from the time prior to just before the Pfizer deal was announced. So in terms of OncoSil, what is it? It's a radiotherapy treatment where you take a radioactive particle and you insert it endoscopically down through the mouth, stomach, and into your pancreas. And I'm going to explain to you more about pancreatic cancer, but this is a very novel therapeutic treatment for pancreatic cancer. We've got a very experienced team led by Nigel Lang. He's actually based in Berlin. Germany is our key market in commercializing this technology. It is already CE mark approved in Europe for use. And we have a huge market. Not only is there a huge population of potential unmet need with pancreatic cancer, but also in terms of access to those markets through the CE mark approval that we've recently received. Now, pancreatic cancer is the worst diagnosed form of cancer. I'm sure you already know that, but I think this slide gives you some perspective in terms of the average life expectancy of patients who have diagnosed pancreatic cancer. It's typically less than 6 months from diagnosis to the point at which you die. There are many different types of cancers, many different types of treatments for cancers, but pancreatic cancer has not had any potential or significant increase in life expectancy in the course of treatment over recent decades, until, of course, OncoSil. In terms of stages of pancreatic cancer, again, just as a familiarizing yourself with what happens in this particular illness, but you can see that only 15% of patients are actually diagnosed with a potential treatable form of pancreatic cancer, in which you actually have some potential life expectancy of any significance. Most people are diagnosed at latter stages, 85%. Their outlook is extremely poor. The best way to treat pancreatic cancer is to resect it or cut it out. But the problem is people are diagnosed late. There's just no option for them in that respect. So 15% of patients are resectable. If you are a potential resectable patient, they will try to cut it out, and that gives you the best life expectancy. Our market is locally advanced pancreatic cancer, which is about 30% of patients. If it was resectable, they would have already cut it out before you get into the OncoSil treatment. But what we're trying to do is reduce the size of that tumor or tumors. So if the tumor is too big, you can't just cut out your pancreas because you will die. So what they want to do is try and shrink the tumor to take you from being non-resectable to becoming resectable. And that is what this treatment does. And the life expectancy is certainly much more significant. In fact, there have been many patients who've been treated with OncoSil who are still alive to this day, some years after they were treated, when they were only given a very short-term outlook at the time of their diagnosis. So in terms of treatments, you've got local or systemic. And in terms of the two targets, obviously surgery and radiation is the key in terms of it's localized. If it's systemic, so the cancer is spread throughout your body, your life expectancy is very short indeed, and chemotherapy is usually your only option. Now, I do have an animation to show you now, and I think this is going to succinctly show you how this technology works. And I don't really need to talk about that. I'll just get into the animation.
OncoSil is a brachytherapy device
We turn this
that
up a bit.
utilizes highly targeted intratumoral placement of phosphorus-32 microparticles to treat locally advanced pancreatic cancer. OncoSil is delivered via ultrasound-guided endoscopy whilst the patient is under sedation or anesthesia. The echo endoscope is slowly inserted down the patient's esophagus through the stomach and duodenum, stopping very close to the pancreatic tumor. A very fine needle is then loaded through the biopsy channel of the echo endoscope and slowly guided through the gastric wall or duodenal wall to directly target the pancreatic tumor. Once the needle is positioned inside the tumor, the exact amount of OncoSil is injected slowly by the physician. The microparticles remain localized in the tumor permanently. Microparticle localization is confirmed by SPECT-CT bremsstrahlung imaging. The implantation is personalized to the patient to deliver 100 gray of the tumor. With a phosphorus-32 half-life of 14 days, 98% of the radiation dose is delivered to the tumor within 81 days. This very significant dose of radiation causes direct damage to cancer cell DNA, rendering the tumor incapable of cell division and proliferation. Through this mechanism, OncoSil treats the cancer and can ultimately shrink tumor masses. In the PANCO study of OncoSil treatment of patients with locally advanced, non-resectable pancreatic cancer, in combination with chemotherapy, tumors shrunk sufficiently that a quarter of patients in the study underwent surgical resection with 90% long-term survival.
I want to remind everybody that this is an Australian technology, Australian company. It's now regulatory approved in Europe. It's the first ever treatment that actually demonstrated long-term survival for pancreatic cancer for locally advanced tumors. I think it's just the most incredible breakthrough in terms of outlook for patients with such a horrible diagnosis as pancreatic cancer. And this PANCO study is the basis for which we received that regulatory approval. And I'm going to talk about that in a moment. I just want to in respect to that animation, there is one term that was used that used the expression localized. Now, I want you to understand that the size of these radioactive particles are only 30 micron in size. They're tiny and they move around. And there are other types of brachytherapy treatments that have been approved where it's not very targeted. Those little particles, they put them inside the tumors and they just float around. And everywhere they go, they destroy tissue. Tumor tissue and healthy tissue. And the outlook for these patients isn't very good, so they get approved anyway. OncoSil is unique because the particles that are used are actually nanostructured and makes them, for the better word, sticky. So because of this strange structure that they have, even though they're so small, when the surgeon places those particles inside the tumor, they stay exactly where the surgeon puts them. That's really, really important when you want to have a localized treatment for solid tumors. And it means the potential for OncoSil is not just, say, in pancreatic cancer. We could potentially, and we will, move into other solid forms of tumors because this is such a novel way of treating it because it is localized. And that's a really important point. In terms of the PANCO study, this was done in Australia. It was a breakthrough study and it demonstrated that the patients who were non-resectable became resectable through this treatment. So that actually gave them a positive outlook in terms of actually undergoing surgery to cut out their pancreatic cancer tumors. So even though 1 in 3 patients were potentially resectable, they actually 1 in 4 actually underwent that surgery, and they resulted in long-term survival. So this has been used many times. It's been now approved in Europe, and we've only just received these approvals. So the commercial outlook for OncoSil is really just starting. And then in terms of generating revenues, that's really what our shareholders want to see. They want to see adoption of the technology and being used more widely in Europe. And of course, getting FDA approval in the United States would be an absolute huge game changer for the company. And that's where we're moving to. So in terms of what we've accomplished, we've already had this experienced team in place. We already now have CE mark approval. I don't want you to get an impression of I'm underselling this. Receiving CE mark approval in Europe to become approved treatment as a radiotherapy device is a massive accomplishment for any biotechnology company, particularly one that was founded out of Perth, Australia. It's a huge accomplishment. It's only just been received, and it means that we can now commercialize. Germany is our key market. We've already set up our head office in Berlin. That's where Nigel Lang is based. And there are some programs that I'll talk about in a moment about how we're going to expand into that German market. We have a pathway for bile duct cancer, which is also in process. We've completed the PANCO study. We've also got breakthrough device designation achieved in the US. So that is a major precursor to then getting FDA approval for this treatment. And we already, as you can see through that list, we have a number of countries that it's already approved in, also including Turkey and Israel, which actually fall outside the European Union. So this innovation funding in Germany, this is an important next step for us. So it's already fully funded for 25 hospitals where they can actually start using the device in Germany at no cost to the patients or to OncoSil. So this is potentially a big revenue generation process. It's all about getting adoption into the German market. I should say that we already have now undergone a number of treatments in Spain, and we've also had a private health cover reimbursement in the UK. So that's just been approved. These are all just happening in recent months this year. Getting that private health cover reimbursement in the UK is a major one because it's going to bring down the cost to patients to nil, effectively, if they're under private cover over there. And this fully funded trial in Germany is also here in terms of getting public company reimbursement. So another fully funded trial, which will, when it commences and then hopefully completes with a positive outcome, which it should do because it's already CE marked approved anyway. So I see very little risk in that not happening. But that would then give us public company reimbursement in Germany. That would be another huge milestone for the company. So just in terms of closing up, where we intend to go, I've already outlined to you some of the major milestones that we've already achieved to date. We have new things that are happening. The reimbursement in Belgium will be another major milestone as well. We're signing new distribution agreements, and we're also going to go after US FDA. We have some work to do on the trial design and the German hospital studies, so that's something to look out for. But most importantly, I want to leave you with this statement in terms of what you should expect to see in the space. So I mentioned at the start about Certex. I can't say to you any more clearer that the outcome for Certex was an acquisition. Now, I know that I get a lot of pushback from shareholders about, we want to generate lots of revenues for this company and see the share price go through the roof, hopefully, which has happened to some of my other companies. But my goal is definitely for a trade sale at some point, because big pharma are the ones that take these companies forward. They're the ones that can create blockbuster products. They don't just step in there until you prove yourself and demonstrate the efficacy of your treatment, the novelty of it. That's what I hope to achieve for this company. I certainly achieved that with my previous company, ResApp Health. It's sad to see that that company is now no longer under my control, but I do know that Pfizer's taking it forward, and they've given shareholders a terrific outcome by acquiring the company for a great deal of money. And I hope to achieve the same thing for OncoSil. I do appreciate your time today. I have a stand that's just outside, and I'm happy to talk to any and all of you at some point during the course of today. And thank you very much for your time.
Thank you, Brian. Thank you, Brian. Altech Chemicals is a specialty battery technology company that has a joint venture agreement with world-leading German Battery Institute, Fraunhofer IKTS, to commercialize the revolutionary Synergy sodium alumina solid-state battery. Chief Financial Officer Martin Stein is a finance executive with experience across the globe. His role with Altech encompasses finance, capital raising, project development, investor relations, and marketing. He's highly committed to increasing shareholder wealth by bringing Altech's exciting battery projects into production. Please welcome Martin.
Welcome to the Batteries of the Future report. There are some real downsides to today's lithium-ion batteries, stumbling blocks that are the focus of international discussion. The batteries can overheat through thermal runaway, which can result in devastating fires and explosions. They operate best in a fairly narrow temperature range between 15 and 35 degrees Celsius. And the lifespan of lithium-ion batteries is limited to between 7 and 10 years, depending on their application. On top of that, lithium-ion battery manufacturers are at the mercy of both supply and pricing of a range of critical metals. Take lithium, for example. It's the most critical component of a lithium-ion battery, and the price has jumped sixfold since the start of this year, 2022, adding upwards pressure to production costs. Add to that, cobalt is considered the greatest material supply chain risk for the industry in the short to medium term. And whilst the Democratic Republic of Congo produces about 70% of the world's supply, human rights abuses continue to raise ethical concerns. There are also supply chain concerns around graphite and copper, which make up the anode part of the battery. The industry is heavily reliant on China because it produces 90% of all graphite anode material. Therein lies geopolitical risk. A standard electric vehicle requires 2.5 times more copper than a standard internal combustion vehicle. A recent report suggests there aren't enough copper mines being built or expanded to provide all the copper needed to produce electric vehicles into the future. But an alternative does exist. The solution is Altech Chemicals Synergy battery, which uses sodium alumina solid-state technology.
Morning, everyone. Welcome to Altech's Grid Storage Battery of the Future presentation. Now, I'd just like to say that this presentation is in relation to a joint venture and a product that we announced to the market on the 14th of September 2022. So it's relatively new. It's good to be able to take this opportunity to start to try and get the message out and the story out. So I'd just like to start by talking about how a lithium-ion battery operates. So what we have on the anode side is we have the graphite and we have a copper collector. Then on the cathode side, we have the lithium and we have an aluminium collector. And then what happens in between is there is a liquid electrolyte and a plastic separator sheet. Now, what a lot of people don't realize is both the liquid electrolyte as well as the plastic separator sheet are highly flammable, and that's what's causing the fires that we've seen in the video. So what the industry is trying to do is move into what's called solid state battery technology. Now, what solid state technology is, it is removing the liquid electrolyte and it's removing the plastic separator sheet, and it's replacing those two flammable items with a ceramic electrolyte. And the ceramic electrolyte allows the lithium ions to pass through, but it's flammable, and it's safer. So we saw in the video the challenges that the lithium-ion battery industry is facing with fires and explosions. So what happens in the electrolyte battery is that the thermal runaway, it's called thermal runaway, and what that is when the chemical reaction produced inside the battery becomes out of control, the temperatures soar to about 600 degrees and it catches on fire. Now, with normal fires, you can put out the fires by taking away the oxygen, and it's taking away the ability for the fire to go. But you might not realize with a lithium-ion battery fire, the oxygen is actually produced at the cathode end of the battery, and it continually produces the oxygen, fueling the fire, and the fires are nearly impossible to put out. Also with lithium-ion batteries, there's a temperature range issue in that the lithium only operates effectively between about 15 degrees and 40 degrees Celsius. So the lithium becomes, at 0 degrees, the battery only operates at a 70% capacity. So lithium-ion batteries are not suitable for very, very cold or very, very hot desert climates. There's also a problem with lithium degradation in the lithium-ion batteries. So every time you charge and you discharge the battery, the lithium breaks down and degrades and you're losing capacity. And there's only a lifespan of about 8 years on electric vehicle lithium-ion batteries, about 7 to 10 on grid storage. So they do have limited lives. And as we've seen in the video, we've seen the lithium price spike sky high over the last 12 months. It's actually increased by 6-fold in that period, which is putting a lot of pressure on the price of lithium-ion batteries. And the video also touched on the cobalt issues. Now, it's unfortunate that 70% of the cobalt in the world is sourced from the Democratic Republic of Congo. There's issues with the supply of that and child labor. And that's putting pressure on the supply chain of cobalt. And graphite, obviously lithium-ion batteries use a lot of graphite. The graphite is sourced predominantly from China. 90% of graphite comes from China. There's geopolitical risks involved in that. And copper, 2.5 times the amount of copper is used in an electric vehicle lithium-ion battery compared to an internal combustion engine for a normal vehicle. Now, there's a lot of expert reports, commodity analysts and the like that are saying that there's not enough copper in production and there's not enough copper mines coming into production that will provide all of the world's copper needs, including for approximately 27 million electric vehicles that are anticipated to come onto the market in the near future. So, is there a battery that is fireproof, that has a large temperature range, can operate for about 15 years, doesn't use lithium, doesn't use graphite, doesn't use copper, and doesn't use cobalt? What do we reckon? Well, here we go. Introducing Altech's Serenergy Sodium Alumina Solid State Battery. And this is the product in its 5 kilowatt hour module. This was produced by our joint venture partners Fraunhofer, or was developed by our joint venture partners Fraunhofer, and it uses sodium technology, so common table salt. And the cells are made out of solid state ceramic technology. So these Serenergy batteries are fire and explosion proof. They don't have the liquid electrolyte and they don't have the plastic separator sheet. And there is no oxygen produced at the cathode level, so they're completely fireproof. The Serenergy batteries, once again, because they don't have the liquid electrolyte and the lithium, they can operate in temperatures ranging from -40 degrees to 60 degrees. So we can put them in desert climates, we can put them in very cold climates where the lithium-ion batteries can't go. So we have a very large temperature range. We have a longer lifespan. We don't have the lithium degradation throughout the life of the battery, causing the battery to have a short life. We have over 4,500 cycles over 15 years. So there's a long lifespan for these batteries. And as I mentioned before, we use common table salt, so sodium. So sodium is actually the next most reactive element on the table of elements to lithium. It's abundant, it's freely available, it's cheap, and that's what we use in our batteries. We're not exposed to rising lithium prices. We don't use cobalt. We've got a different capacity in the battery, different chemistry in the battery. We don't need cobalt at the cathode level. We don't have any supply chain issues with the cobalt. And we don't have any graphite. We don't need it, and we don't need copper at the anode section. The unique thing about these batteries, and I'll explain it more in detail further, but the unique thing is that the anode is created on charging. It's a sodium anode, and on discharging, the anode dissolves. That's the unique feature of this battery. It's very good technology. So this battery is focused on the grid storage market. So we're talking about might be a solar farm or a wind farm that produces power at certain times of the day but doesn't utilize all that power. We need a solution to put that into a battery and then provide back into the grid at a later time when the energy is needed, maybe at night time. So that's what the market we're focused on is. The grid storage market is very interesting. It's forecast to grow at a compound annual growth rate of 28%. The market at the moment, or in 2021, had a size of about 4 billion. It's expected to grow to 2027 to 15 billion. It's a very lucrative niche industry. I think the industry is mostly focused on electric vehicles at the moment, but there's going to be a lucrative niche industry to provide battery storage solutions for this. So how does the AS battery work? Very interesting technology. You start with a ceramic electrolyte tube, and in the middle of the tube is a positive electrode. And in that tube is the salt granules mixed with nickel metal powder. And then we flood that tube with sodium alumina chloride, and the ceramic tube just sits in the canister, and the steel canister actually acts as a negative cathode part of the battery. When you charge the battery, all the sodium ions from the sodium alumina chloride medium migrate through the ceramic tube, and this forms a sodium molten anode. So it's a self-forming anode. And then when the battery discharges, the sodium then separates from the chloride, and the sodium comes back when it's discharged. The unique part of this battery is when you charge it, it forms the anode, and when you're discharging it, it dissolves the anode. So it's very interesting, very cool technology. And it was technology that was developed by our joint venture partner, Fraunhofer. Now, I think it's interesting to note who our joint venture partners are. They're a world-leading German research institute for battery technology. They're government-owned in Germany, the German state government-owned. They've got 76 institutes throughout Germany, and they employ about 30,000 people, mostly scientists and engineers. And they've got an annual research budget of 2.9 billion. So we're very, very pleased to have been in entered a joint venture with a institute such as Fraunhofer. Fraunhofer spent 35 million euros over the past 8 years developing this battery. They've got pilot plant facilities in Hermsdorf in Germany that they've spent 25 million euros on. That pilot plant facility is available for the joint venture to use. And Fraunhofer is heavily involved in commercializing the product. Now, Fraunhofer was looking for a joint venture partner that had land available in Germany, that had battery experience, that also had experience in high purity alumina. High purity alumina is what the ceramic cell is made out of. And Altech met those requirements, and the joint venture was formed. And this is the pilot plant facility where they've developed the battery in Hermsdorf. This is the 25 million euro facility that's available to the joint venture to use. We can see here the high purity alumina being mixed to make the ceramic tubes. There's a ceramic tube being pressed. That's the electrolyte. That's the ceramic tubes being kilned. That's a final ceramic tube product. And then there's a 10 kilowatt battery there, tested, ready to commercialize. So why did we pick Germany? Well, Germany has a lot of investment and a lot of interest by the government in battery technology and energy storage. So we have some land in Saxony. It's not far from where Tesla's just announced its 1 gigawatt factory. We own this land, 14 hectares of land that we own there, that we're planning to build a 100 megawatt hour factory to produce this product. And we're currently doing a bankable feasibility study on the project. Big advantage for these products compared to lithium-ion batteries for grid storage is obviously the cost. Cost is going to be a big factor. We don't use any of those expensive metals like lithium, cobalt, copper, or graphite. We use sodium and nickel metal powder. So Fraunhofer have estimated that the reductions on the costs of producing these batteries is going to be in the vicinity of about 40% cheaper than lithium-ion batteries. So it's revolutionary technology, and we're targeting the grid storage market. We just announced today, actually on the ASX, this is hot off the press, that we've launched the battery design for a 60 kilowatt pack. Now you can see there the pack has got 240 cells in it, 5 rows high, and we'll be able to get 20 of those battery packs into a sea container to make a 1.2 megawatt battery solution. So the first stage of the joint venture is to commercialize the 100 megawatt hour factory, but the joint venture's train 2 is going to be focusing on a 1 gigawatt hour factory. Thank you very much for your time.
Dr. David Menzies is Chief Executive Officer of NematiQ Pty Ltd, and he owns, or he is involved with Clean Tech Water. They provide a wide range of water treatment solutions to customers around the world. David holds degrees in materials engineering at both bachelor's and PhD levels and business at bachelor's and master's levels. He's worked in manufacturing, professional services and research organizations in strategic planning, marketing, sales, senior management roles. In that he has taken several new technology products to market and is leading NematiQ to do just that with its novel graphene nanofiltration membrane. Please welcome Dr. David Menzies.
There's one we prepared earlier. Thank you very much for your time. Isn't it great to be back out again? After a couple of years of not being able to do these shows, I think it's fantastic and it's a very well run show. So as mentioned, part of Clean Tech Water, we're a subsidiary, it's called NematiQ. We have a graphene membrane. It's one of the first deployments of that new materials technology, and I'm very excited to tell you about it today. Quick disclaimer, we won't go through it, but do your own research. So Clean Tech Water, it's got quite a small enterprise value, which presents a upside opportunity, but again, do your own research. In terms of the management, there's Willem, Magda and myself that are the key management personnel. Peter, the chairman, is also here today, who is the executive chairman, CTO and founder of the company from about 30 years ago. So Cleantech has a business, there's 3 divisions. There's the water solutions business, there's the graphene membrane business, and then there's the direct metal extraction organization. Sunrise Energy Metals was born out of the direct metal extraction part of the business, and that at one point was a $1 billion enterprise. So NematiQ, what are we about? We're cleaning water. We're trying to protect nature's water cycle. We have a very effective separation technology here. But what we're trying to do is to use this to make sure that our children and their children have safe, accessible drinking water into the future. Filtration, for those who don't know it, has a number of different sectors. There's different particle filters, microfilters, ultrafilters, nanofilters, and reverse osmosis. Reverse osmosis is a very expensive technology. Existing nanofilters are also very expensive technologies, not only to purchase them, but also to run them. The operating costs are quite large with high energy requirements. What we've developed is a nanofilter that operates at the lower energy requirement of an ultrafilter. We had a global membrane specialist come and visit us last week. And in his own words, he said, we're holding the holy grail here. So what are we trying to, what are the problems in water? Clean water is becoming scarce. Generations before us and ourselves, we're polluting all of that. What we're trying to do is to effectively remove all of the pathogens, micropollutants and organics without taking the salt out. Taking the salt out of water is where all your energy demand comes from. 10% of the world's energy goes towards doing just that. And a lot of those applications don't actually require desalination. This membrane is very broad in its use. So what we've got is we've got a very innovative product. We're using graphene. It's a very advanced material. We're deploying it in a very simple way where we can produce it en masse. We're producing this in its kilometre format. We've got something that operates at a very low cost, as described earlier, with the lower energy requirement. It's sustainable in terms of not having brine byproducts, and it's very versatile, which we'll touch on a little bit later. So in terms of the membrane market, it's sitting within the water market, which is about $850 billion a year market. The membranes themselves are only about 15 billion of that. We're trying to address about 8 billion of that in terms of the area of taking out micropollutants and also improving the desalination market. In terms of the main players, the household names, you've got DuPont's and 3M and the likes in there. They tend not to do too much innovation. They've taken their products to the furthest technology point they can. What they do is they buy new players that come into the market to maintain and grow their market share. So in terms of the new kids, there's a few there. The second one down, NX Filtration, have a valuation of in excess of 500 million euros with about $1 million revenues. The two other businesses there in the box are Evove and Via Separations. They've gone down the same route of looking at graphene as the separating material. And Zwidco is doing very similar work to us in terms of agriculture and food and beverage. So in terms of the development timeframe, we're talking about new materials technology. These things take a long time. This is a project that's been going on for 10 years. Only some of those years are displayed here. But effectively, what we've done through collaboration with Monash University here in Melbourne is to take a basic materials technology and deploy that in production. We are producing large membranes. What you see here on the stage is the largest membrane size that exists. It's called an 8040. If you need to filter lots of water, you just bank them up and match your demand with the number of membranes you place. Where we're up to now, so we've taken the manufacturing to what's known as manufacturing readiness level 9. We're taking now the technology up to the commercialization stages, which is 7, 8, and 9 in the TRL scale. And to do that, we've built a pilot plant, and we're going to be deploying that onto customer sites to process waters directly. So what do we got? Graphene, it's a wonderful material. The way we're using it is we're taking it and we're creating a 1 nanometer channel. With that 1 nanometer channel, only things smaller than that will pass through. So dissolved salts, dissolved metal ions will pass through our filter. Anything larger being your pathogens, organics, and other matter do not pass through. This is happening at very high water permeance levels, which creates a much lower energy usage footprint compared to other nanofilters. Most importantly, however, it's got a low fouling potential. Graphene oxide creates a super hydrophilic surface, which makes the filter both oleophobic, which means it rejects oils, and also makes it resistant against organic material sticking to the surface and then having to do extensive cleaning cycles of the product. We can tolerate chlorine to a very high level. And another important feature is we can operate over a broader pH range compared to all other existing nanofilters. So where we're going to apply this, as I said, we're sort of TRL 6, which means we're prototyping in a laboratory in terms of our testing. we're going to be deploying this into the field, and that's starting in the next month. The areas we're looking at are pre-treatment for seawater desalination, and that's largely governed by water authorities. Water authorities are also in charge of your drinking water and treated effluent, which is otherwise known as sewage treatment. And then there's the industrial sector, which accounts for, again, a large part of the water market. And we're laser focused on improving the water quality in agriculture and food and beverage in that market. So a quick snapshot, what is filtration? For those who haven't done an engineering degree or haven't used these products that much, you have a feed water that comes in there. You apply pressure across a membrane, and anything smaller than the channel, in our circumstances, 1 nanometer, becomes your permeate. So that's your filtered water, which you see down there. And anything bigger gets concentrated into what's known as the retentate. And you can see the feed water is a bit brown, and then that's getting pretty greeny black, which just means it's all the organic in there is getting far more concentrated. So seawater desalination, what we're looking at there, this is just laboratory level testing, is to reduce the cost of biofouling in that market. Biofouling comes from the mixture of both the microbes and the organics. Our product attacks both of those and removes them from the system, which will result in a far more efficient seawater desalination process because they'll go through less cleaning cycles. In terms of municipal waters, it's the biggest of all the markets in water. It's about $620 billion US market per annum. Half of that's for drinking water, half of it's for treating the wastewaters. We're looking at both sectors at the moment. This one here is in Australia. That's a dam. We're looking at putting a pilot there in the near term. And what we've done is we've taken the feed, created a beautiful water that's suitable for drinking, but it's not defined as drinking water. It needs to have chlorine added to it at that point. And then we've got this retentate here, which is full of organic material. The organic material and the drinking water are both products in these circumstances because that organic material can be sold to fertilizer and soil improver industry. In terms of the secondary effluent, same story. You can see a beautiful water is coming out of that, which can reduce the time that the water needs to settle into those plants and therefore increase their throughput. In terms of industrial wastewater, as I said, it's a pretty big market, $222 billion US per annum. We've attacked two very, very nasty areas where you would never stick a normal membrane, but because we've got one that operates over a wide pH range and has the anti-fouling properties of our membrane, we've thrown it into some areas that you just wouldn't see. So landfill leachate, obviously methane comes off old landfills, but so does a leachate, that's the liquid waste. What we're doing is we've done some processing of that, converted that into a much safer permeate for release so that the custodian of that land doesn't have to pay large fees to get their leachate treated. And then we have here a very concentrated organic solution, which again, depending on what's in it, could become a product or dramatically reduces the volume of waste they need to transfer to the likes of Suez to treat that. Black liquor is a byproduct in a lot of industries. This one here is in pulp and paper. That costs a lot of money to get rid of. It's got a lot of bad stuff in it. What we're looking at doing is to effectively, that's the feed there. They're in a different order just to keep everyone on their toes. And what we're doing is we're concentrating it up to something that's far more viscous. You can kind of see it here in this sort of splatter picture here where you've got something that's reasonably fluid going to something that's highly viscous, more like a honey. And that reduces the evaporation cost within pulp and paper industry. So we've been doing some trials in that space. But those aren't our main market. So our main market that we're going to address is vegetable wash waters at the start, but more broadly speaking, the agricultural space. So we signed a memorandum of understanding in September with a group called Schroers & Sons, one of the largest celery and leek producers in the country. That guy there, Chris, if you go to Coles, you'll see his face on the little celery sticks you buy. And what they've got is a water what they've got is a water demand of about 40 cubic meters per hour. Those elements there, we can produce about 1 to 1.5 cubic meters per hour. So if you do the sums, you can understand the size of the plant that they require just to treat their waters. What we've done is we've taken out all of the microbes, all of the organics, but left the salts in to create a very beautiful permeate. The retentate would then get sent back to their dam so that nature can do its course and everything can settle out and get back into equilibrium. In terms of the market for food, beverage and agriculture, it's the biggest water demand in the world. It takes 70% of our fresh water. A lot of that is using treated effluent from sewage plants and treated wastewaters from other areas, as well as taking it directly out of streams and rivers. The market for that is growing. In about 10 years, it's expected to be 73 billion. That's a lot smaller today. But what's occurring in that industry is a growing ESG requirement, which is hitting a lot of industries, but this one in particular because they create a lot of environmental problems with runoff. So what we're doing is we're trying to close the water loop on their system without having a high cost. And this is the capital that we're using to deploy onto the sites. It's our pilot plant. I call it Frankenstein. It's an ugly one. It's our first one. It's going to look better into the future. But what you have there is a pressure vessel where one of those 80-40 elements sits that produces about 1.5 cubic meters an hour. And then here are two what are known as 40-40 elements. We've got one of those on the stand. They do about 1/4 of that in terms of their water output. And with those, we'll be producing waters on site for the customers to make informed decisions. So what are we? We're a high technology point manufacturer. We're in an advanced materials space. We're an advanced manufacturer. We're solving unmet needs. The agricultural market is very poorly served or underserved at the moment, and it's growing. In terms of the overall technology, as I said, we've been reported to have the holy grail in our hands, so we need to use it wisely. We're part of Clean Tech Water, code CNQ, put it on your watch list. We're NematiQ. Thank you very much.
Thank you, David Menzies and Frankenstein for that presentation. Taking us to lunch, no, not quite yet, two to go before lunch. Dr. Luke Reid is an experienced research and technology commercialization executive. His deep knowledge in the biotechnology sector has underpinned Microba's growth into a global biotech company delivering on its mission to improve human health with precision microbiome. God above, it's a simple word and I managed to stuff it up big time. Dr. Reid's expertise in translational research, technology commercialization, commercial partnership, licensing, and intellectual property management uniquely places him to lead Microba as a Chief Executive Officer. Please welcome Dr. Luke Reid.
Thank you. And great to be here to tell you all about our company, Microba Life Sciences. So I think it's been just over an hour since everyone indulged in morning tea. I want you to think for a second about where that food goes through your digestive tract, ultimately to your colon, where it collides with trillions of organisms that then produce a vast array of bioactive metabolites that move systemically throughout your body to impact your health and also the development of a range of chronic diseases. And at Microba, our investment thesis is that those organisms known as your gut microbiome represent one of the biggest untapped opportunities to improve human health. And because of that, we're going to see microbiome testing and microbiome therapeutics become a routine part of healthcare. So at Microba, with world-leading technology, we've been deploying to develop a dominant market position in both microbiome testing and discovery and development of those novel microbiome therapeutics. Just move past our disclaimer. The way that we capture this global healthcare opportunity is through firstly delivering testing services globally to clinicians, consumers, and research clients, together with an expanding distribution partner network. Those services are then building this large proprietary data bank through consented and de-identified customer data. And then we're mining that data to discover and develop multiple novel therapeutics to ultimately execute big pharma out-licensing transactions on those assets. We're a really unique biotech company, I think, on the ASX because we are commercial stage and already delivering revenue. So we've got products in market now that are rapidly expanding globally, in addition to having the upside of those big pharma transactions and those therapeutic deals. We have partnerships with a range of multinationals and market leaders, and I'll tell you a bit more about those. We've developed what I believe is the most valuable microbiome data bank in the world. And from that data bank, we have 3 key therapeutic programs that we're focused on. And we have our first lead drug candidate just about to enter a first in human clinical trial. This is a fast growth emerging market that we're tackling with our world leading technology that's supported by peer-reviewed publications and our 2 co-founders who are leaders in this field and in the top 1% of cited researchers globally. And underpinning all of this, we've constructed what I truly believe is a world-class team, including one of Australia's most distinguished clinical scientists, Professor Ian Fraser, who is the inventor of Gardasil, the cervical cancer vaccine, which is now a $5 billion in annual sales drug for Merck. So firstly, I'll take you through our services that's delivering those growing global revenues, and then I'll switch over to run you through those therapeutic opportunities that we're developing that are tracking towards the clinic. Firstly, on our testing services. So we're listed on the ASX in April this year, and even since then, we've executed a range of really key milestones. We have just entered into a distribution partnership with a leading GI pathology company based in North America. So that's just opened up the US healthcare market to Microba for the first time for delivering these testing services. We just entered into another distribution partnership and have commenced operations with a company called G42 in the Middle East. They're an incredibly well-capitalized and aggressive health tech company based in the GCC region. They've recently raised $800 million led by Silver Lake out of the US to accelerate their growth in delivering precision healthcare across the GCC region. We signed another distribution partnership for a new product here in Australia with a company called Midnight Health that was recently backed in its 2nd round by major health insurer NIB. And we've just launched a new version of our healthcare product into beta and is about to move into full launch, which is going to continue to expand the application of microbiome testing in healthcare. The way that we commercialize this testing on our services side is through a distribution partner model. So we work with fantastic distribution partners that have deep access to customers in their market, and we equip them with our world-leading technology to deliver a microbiome test powered by Microba. It becomes a SaaS-like model for Microba with very high margins, and we've been accelerating this distribution partner network very quickly post-COVID. So one that I haven't mentioned yet is SYNLAB. They're in Europe. They're Europe's largest pathology company. They're essentially the Sonic Healthcare equivalent of Europe. And just a couple of weeks ago, we announced that based on their initial success in Spain and Colombia, they've revised the master agreement together with us to trigger their rights formally to expand across Europe and Latin America. So the growth is well and truly ahead of us with SYNLAB, the activation of Genova, G42, Midnight Health. But importantly, we're continuing to rapidly expand this and the distribution partner network. So there's no question that for most companies, there was a degree of COVID impact. For us, anyone with an accredited laboratory had to turn their attention to delivering COVID testing. But as that's come off, what you can see that is immediately as COVID testing has declined, and there's been the need for growth in delivering testing services and pathology services from these major pathology companies and also companies looking to deliver consumer-initiated healthcare services. We've just significantly increased that distribution partner network, and we've got a pipeline which is very active, over 20 leads, 10 qualified opportunities, and now we have multiple that we're about to close for some really significant countries globally that we haven't tapped yet today. So there's potential of 18 new countries that sit in that pipeline and 4 new distribution partners that would deepen our penetration into the US market. So the formula for success here in our services business is quite simple. We need to have fantastic market-leading testing products that are progressively bringing this into a routine standard of care. And we see that ultimately this will become as routine as a blood test. And secondly, we need to have fantastic distribution of those tests. And that's exactly what we're executing here, which is growing very quickly. So in addition to delivering those global revenues, that's also delivering this growth in this proprietary data bank that we've been building for 5 years now. And what we've established is a truly repeatable platform for drug discovery from the microbiome that's generating multiple therapeutic assets. So we have that large data bank of not only deep gut microbiome information using our world-leading genomics technology, but also rich information about the individual's state of health, from the medication that they're on, any ailments, mental health status, physical activity, a whole range of metadata points. We have a really good understanding through a defined healthy cohort that we've been building internationally to understand what healthy looks like from those organisms that live in your gut. And then we match that and compare that against a defined disease cohort. We apply a range of advanced biostatistics methods together with machine learning under the leadership of our Chief Scientific Officer, Associate Professor Lutz Kraus. And that enables us to find what one of our co-founders defines as the needles in the haystack. Who are the key organisms that represent therapeutic activity and differentiate the healthy individual from the diseased individual, and what can we understand about their biology? We then bring that into the laboratory, take that through a range of disease models, and then ultimately into human clinical trials. And that's exactly where we are today. So we have 3 excellent therapeutic programs, one targeting inflammatory bowel disease, the second in cancer immunotherapy, and the final in autoimmune diseases. So firstly, for inflammatory bowel disease, we're targeting one of the major forms, ulcerative colitis. We found key organisms that are very prevalent and abundant within healthy people, but consistently missing or in low abundance in people with ulcerative colitis. We've then brought them into gold standard models of disease and demonstrated that they have very potent, not only anti-inflammatory activity, but also wound healing properties, which can address the ulceration in the gut. And that's something that the clinicians don't have in their toolkit today to address ulcerative colitis. So our lead candidate, MAP315, is now moving very quickly towards the clinic, and we will have that first dose in humans, phase 1 trial initiated in the first half of next year. The second program, which is closely behind that, is a really interesting area in microbiome science. One of the breakthroughs in cancer care has been cancer immunotherapy, and in particular, a class of drugs called immune checkpoint inhibitors. The leading immune checkpoint inhibitor from Merck, Keytruda, sold $5 billion last quarter. They've been an absolute breakthrough in cancer care, but unfortunately, they only work in around 30% of patients. And everyone's been trying to work out, well, what differentiates someone that responds and doesn't respond to that important class of drugs? And it's now quite clear that the gut microbiome may be the major factor differentiating the responder and the non-responder based on the way that that community of organisms modulates and trains our immune system. There's been now phase 2 studies demonstrating that you can change the microbiome and turn a non-responder into a responder of those drugs. And what we've been able to pinpoint, we believe, is the key organisms in biology that differentiate the non-responder and responder. We're now bringing that into preclinical animal models, and we'll have first data from those models early next year. And then finally, we have a very ambitious program looking to address multiple autoimmune diseases in partnership with New York Stock Exchange listed Ginkgo Bioworks, who were also a strategic investor in our IPO. So that program, we've now delivered to Ginkgo multiple interesting organisms that we're running through a broad screening program to characterize their activities and understand their application against multiple autoimmune diseases. And we'll have first data out of that screening program early next year as well. This is all happening at a time where we're really on the cusp of a new therapeutic revolution with these microbiome therapies. And importantly, there's a major catalyst about to occur in the sector, with the first FDA-approved live microbiome drugs. Rebiotics have been right at the forefront of this space and have just received a positive vote from an advisory committee to the FDA to vote in favour of approving their live microbiome drug. Precedent would say that that should flow through to a full approval sometime before the end of this year or early next year. And then closely behind them is a company called Seres Therapeutics, listed on the NASDAQ with the ticker MRCB. They recently had their BLA application through the FDA for their live microbiome drug accepted in full, which then sets them up for an approval, which they put out they're expecting to receive in the first half of next year. Importantly, both of those therapeutics, although important to clear and open up the FDA path, are based on donor fecal materials. Clinicians, payers, pharma companies all want to see rationally developed biological drugs that can be scaled in manufacturing and delivered to patients globally. And that's where Microba is sitting. We have these next generation organisms where we've been able to pinpoint the specific biology and develop them into drugs that can be manufactured at scale to treat millions of patients globally. So with an FDA path clear, with manufacturing de-risked and these next generation organisms and pieces of intellectual property, we believe we're very well placed to do multiple big pharma transactions through time. And looking ahead, we've got some really important milestones coming over the next 6 months. As I mentioned, we listed on the ASX in April. We've delivered a range of milestones, but we've got a lot coming up very soon. We're about to see full feature launch of that new healthcare product, which significantly expands the market opportunity for Microba. Expansion with SynLab, which both us and SynLab have put out publicly. And we're expecting to sign and announce multiple new distribution partners across the remainder of the financial year. We'll see multiple key milestones as we progress towards that first in human clinical trial for inflammatory bowel disease. And we'll see the first results of our immuno-oncology program and the autoimmune disease program. Finally, I'll just wrap up by saying we are very well funded. We had a very successful IPO in April. When we last reported our quarterly at the end of September, we had just over $26 million in the bank, and we just received a 2.6 million R&D tax incentive claim. So that puts us in a really strong position to continue executing on that services growth, but also continue to advance those key therapeutic programs towards big pharma out licensing transactions. I've got a desk just in the room there, so please come to have a chat with me and be excited to tell you more about what we're doing at Microba. Thank you.
And just to prove to you that I can do it, microbiome. Taking us to lunch, Arovella Therapeutics. It's a biotech company focused on developing therapies to treat human disease. There are two areas of focus: are oncology and conditions that impact the central nervous system. Dr. Michael Baker is the CEO and MD and has been involved in the sector for more than 15 years. Before joining Arovella, his career spanned academic research, drug development, and venture investing. Michael Baker, Dr. Michael Baker.
Thank you very much for that introduction. And of course, thank you very much to everybody who's taken their time out of the busy schedules to come and listen today. And thank you to the organisers for putting this event on. So that's right, we are a biotechnology company. I'm looking forward to taking you through the current story of where we are today, but of course, how we're positioned moving forward. I will skip over the disclaimer. Now, I'd just like to start with the highlights of our company. So, as I said, we're a biotechnology company and we're looking to transform human health. So to do that, in particular tackling cancer, we've decided that we're going to work with world-class partners. So we've licensed our core platform technology from Imperial College London. For those of you that don't know, it's consistently ranked as a top 10 university worldwide. We've licensed our second technology from the MD Anderson Cancer Centre, which is often regarded as one of the, if not the best cancer centre worldwide. And we're delighted that recently we partnered with another very successful Australian biotech technology company, Imugene. So again, that's very important for us to move forward, that we've got great technologies from great research institutes. Now, that all gives us what we call an allogeneic platform, and I'll explain what that means in a moment, but essentially it gives us multiple shots on goal to target a range of different cancers, both liquid cancers and also solid tumors. Now, at the heart of our DNA as a company, we have and we will continue to look to acquire new technologies that are either standalone from our platform or where we see that there's great synergies to combine with our platform. Now, we're very data driven, so that we use data because we think that underpins great therapies, and that starts with great science, hence why we partner with the world-class research and universities. In terms of our team, we've worked very hard over the last 18 months to build an outstanding team, both board and senior management. We've got a few recruits now from the US, which is great, and something we'll continue to keep doing as we move forward. But equally as important to the technology is the team. And so for these reasons, we do see that Arovella is poised for growth. We're the only company working on what we call an invariant natural killer T-cell platform that's listed on the ASX. And for the technology from MD Anderson, we are the only company worldwide that has that particular technology. So in terms of our financial overview, we're currently capitalized around the $20 million mark. At the end of September, we had $4.3 million cash in the bank. And I will point out that does not include our R&D tax incentive return, which we're expecting in the short term. In terms of our current business, we also closed down or announced that we're closing down one of our research and development facilities in Western Australia, which will also allow us to divert the resources into our iNKT cell therapy platform. So in terms of our shareholders, we're delighted that Merchant is our largest shareholder. They're a successful biotech investor. I've had numerous wins, but lovely that they came in and cornerstoned our placement earlier this year. But of course, we're always looking to welcome more investors to the register that understand the risks that come with a biotechnology investment, but also the potential returns that can be achieved. So in terms of what we focus on, I mentioned it a moment ago, but in a word, it's cancer. I look around the room and I'm sure everybody in this room is impacted in some way, shape or form. I know I am. And that's because of the prevalence of the disease, with more than, well, close to 20 million diagnoses in 2020 and around half as many deaths in the same year. So it's still an enormous challenge for society, but of course, with that challenge comes an enormous commercial opportunity. And so from that angle, that's where Arovella looks to play. We want to make an impact on humanity, but at the same time, we're looking to make a commercial impact for our investors. And more specifically, what we focus on, it's a type of technology called a cell therapy. Some of you I know I've spoken to, you already know about it. And it's got another name that we often use as CAR T. And why we're so excited about it is because we're starting to use the word cure and cancer in the same sentence. And that's a lovely place to be, because these are two separate culmination of reports that happened earlier this year, where groups of patients that took these therapies experimentally more than 10 years ago are still cancer-free. And that's why we're saying cure and cancer together. So more in line with what we're doing is we're actually working with a cell therapy. It's not what we call a T cell. And apologies for the jargon, it's what we call an invariant natural killer T cell, and we prefer iNKT for short. So delighted, we actually had an announcement out this morning that our patent to manufacture this therapy was granted in, or will be granted in Europe, which is great news for the platform as well. So as I mentioned, we work on CAR iNKT, not T cells. And I'd just like to point out how the therapy actually works, because it is quite different and a long step away from things like chemotherapy, where we actually start from a healthy individual. We collect the blood cells of that person, and then we isolate the immune cells, in our case, the iNKT cells. They have something on their surface called an invariant T cell receptor, ITCR for short, and that already enables these cells to go after and kill cancer naturally. What we do, and this is where the heavy duty science comes in, is we reprogram them genetically so they produce what's called a CAR for short, or chimeric antigen receptor, and that's why we call it CAR iNKT. And that basically becomes like a guided missile to enable the cells to be dragged towards the cancer, attached to it, and then trigger its destruction. So once we've successfully achieved that, we grow them up, so there's billions of cells. We then freeze them or vial them and then freeze them, and so they can be then used on a patient as and when needed. So I'd just like to talk about the advantages over iNKT cells versus the original and the approved therapies T cells. Really importantly for us is iNKT cells don't cause something called graft versus host disease, which is when the cells will actually attack somebody if they're given from one person to another. So the original therapies must start at this point here. They actually take the patient's immune cells, re-engineer them and give them back to that same patient. And all in all, what it means is the therapy needs to be made for every single individual specifically. So it's very cost ineffective at about $500,000 per dose. Of course, logistically, it's very challenging. Now, we're not expecting to have that issue because of our iNKT cell properties. Now, in addition to that, they're also one of the most potent immune cells. So they're very fast acting, and I'll show data for that in a moment. In addition, once they have themselves have been activated, they also drag other components of the immune system. So you get another bystander effect on the cancer cells. And we've got data to show that when we actually have cancers that produce CD1D, we see that they actually perform better than conventional therapies. So if we were to look on a molecular level, how this might look, how it might work. So we start with the iNKT cells, the ITCR that kills cancer cells. The CAR iNKT cell is made by engineering to bring in the CAR, and then the ITCR finding CD1D on a cancer cell. And then here we'd have the CAR actually finding what we tell it to on the cancer cell, triggering the bursting of those particular tumor cells. And as I said, we also get the bystander effect by bringing in other components of the immune system. So in terms of our pipeline, we have three major arms that are currently under development. We have ALA-101, which we're using to target a range of what we call CD19 producing blood cancers or lymphomas. Now, we're actually also using the same products, and delighted that we've entered into a strategic collaboration with Imugene to treat solid tumors, and I'll talk more about that in a moment. And we have our third arm, which is using a target that's completely unique to our company, and we licensed that from MD Anderson, and I won't talk about that today, but happy to take you through it more if you come over to our stand. So just to show you that there is good sense and good data behind this, and I apologize, it's come out quite small here, but I just want to highlight three major points for our technology, and this is data that's already been published. And so what we see and why we think this will be an effective blood cancer treatment is we see that our cells are much faster killing than the conventional therapies. So the top rows are just animals that have been given engrafted with a particular form of cancer here that produces CD19 and CD1D. And then we're looking on the bottom two rows at 3 days post the treatment of those animals with the particular therapy. Now, the first four rows, or what we call columns, I should say, are what we call controls. But most importantly, I'd like you to look at this fourth one here, where we've got essentially what would constitute the conventional or approved cell therapy. And you can see after 3 days, like the controls, there's a lot of color still present, and that tells us the animals still have cancer in their body. And then if you look at the very last column, it's our therapy after 3 days. You can clearly see that all the tumor cells have been successfully eradicated. So we know, one, it's very, very fast acting. Now that's great, but we also need to know that it's going to promote longer term survival, because that's the goal. So on the bottom here, we've got what we call a survival curve. The vertical axis is how many animals are actually alive, 100% at the top and 0% at the bottom. And we're going out over time on the horizontal axis for 90 days. So again, all the control animals, they die between 40 to 60 days. Now the T cell therapy, which is currently the gold standard, they are about 60% alive at 90 days versus our therapy, it's in the order of 90 to 95. So again, faster killing, better survival. So we're already comfortable that this is looking like it's going to be a superior therapeutic. Now, what was interesting is in our study, 4 of the mice actually were cured of the cancer, but it actually came back between 20 to 40 days. And specifically, you can see the color in the brain of the animals. So naturally, you think in these cases, the animals will die. In this case, they didn't. They were spontaneously, they underwent what we call a spontaneous secondary remission. So the cancer went away a second time, which I haven't seen too many therapies, even at the preclinical stage, do something like that. So it tells us that they're able to remain to be active, and they can also cross into the brain and potentially could be a useful target against solid tumors. So that's a nice transition into the partnership that we've got with Imugene. Many of you may know Imugene is a biotechnology company. They're greater than $1 billion biotech, so it's delightful for Arovella to be partnering with them. And again, it's underpinned by the great science that we have from both of the platform technologies that we think can be used together to have a greater impact against cancer. So what do Imugene actually have? It's called an oncolytic virus. Now, many of you will know, actually everybody in this room will know about viruses because of COVID. Obviously, that infects healthy tissue and healthy cells. What the researchers at City of Hope, particularly Professor Yuman Fong, have done is created or work with a virus that only infects tumor cells. And so on its own, it actually has anti-cancer properties and already kills the cancer cells. But what Dr. Saul Priceman has done is taken that a step further. And now what the virus will do, it will infect the tumor cells, and it will actually mark the surface of those tumor cells with something called CD19. And that's what our therapy will recognize and kill. So together, we think the combination is very exciting, and we're looking forward to testing them in preclinical studies. And so what that's done for Arovella in terms of our lead program, ALA 101, is, as I said, when we were prior to the deal with Imugene, or the partnership, I should say, we were looking at this state of the world where we were going to use our lead therapy to treat a range of blood cancers. So CD19 producing lymphomas. Now, what the collaboration with Imugene allows us to do is actually widen our focus substantially. And now we can target solid tumors. Now, for those of you that don't know, solid tumor diagnoses actually represent about 90% of new cancer diagnoses. So it's a $210 billion plus market. So it really opens up an exciting avenue for both companies to tackle solid tumors. And so with that, I'd just like to talk about some of the upcoming milestones that we've got for the remainder of fiscal year 2023. As I mentioned before, so we've gone through a strategic planning process. We've made the decision that we're going to focus the resources of the company towards our cell therapy programs. And so we're closing our R&D facility in Western Australia. In terms of our lead program for the blood cancers, ALA 101, we've selected the two major component manufacturers that we need, and we're going through the process of creating this and scaling it up so that we can initiate clinical trials. And for our partnership with Imugene, we have finalized the agreement. We're working through the study plan and looking to get some preclinical studies underway, but expecting data in the short term, both in vitro or test tube data, but also then animal models as well. And same for our technology that we licensed from MD Anderson. This is the technology we're using to target multiple myeloma and solid tumors. We're working through and expecting to get data quite soon about the validation of this particular target, and then also working to complete in parallel data for both in vitro and in vivo or animal models. So once we have that data for that, we can optimize that chimeric antigen receptor, or CAR, and then start moving through the formal development studies. So we're on the way to starting clinical trials. And as I mentioned a moment ago, we'll continue to screen research institutes and universities to find new technologies that we think align with our platform or are standalone. So with that, I'd just like to summarize why we think we are a good investment opportunity. As I said, we have world-leading partners through Imperial College London, MD Anderson, and now Imugene. We've got multiple shots on goal to treat a range of different cancers, both liquid cancers and solid tumors. We will continue to look to find new technologies, said using data-driven approaches, both to find them, but also to go into the development and to pick the various clinical indications of interest. As I mentioned, I haven't talked through it, but I'd encourage you to come and see us. We've got a world-leading team underpinned by 4 new recruits from the US in the last 12 months. And again, as I said, for these reasons, we do believe that we're well positioned for growth, even though the biotech sector's had a rough 18 months or so. We are looking forward to a pretty exciting 2023. And with that, I'd like to no longer be in the way of the audience and lunch. And thank you very much for your attention.
Thank you. Just before we go to lunch, it would be remiss of me if I did not remind you that today is the birthday of 2 members of our team. Jackson Crabb celebrates a birthday today, and Jackson Tasker also celebrates a birthday today. Apparently, there was a shortage of names, so Jackson seems to be the popular choice. Okay, lunch is next, ladies.